There's three different groupings of patients. Some that have pre-existing heart disease, and then sadly, they get newly diagnosed with childhood cancer. They're at a particularly high risk of having problems tolerating life-saving cancer therapies. So those are patients that a pediatric cardio-oncologist carefully manages during their therapy. Second group are patients that don't have known pre-existing heart disease. They get diagnosed with childhood cancer, and most of the therapies used have cardiovascular side effects or toxicities. But some children are more susceptible than others. Some may have a genetic predisposition to get heart damage. We did one study where a child that carries one mutation for a gene in the hemochromatosis gene has a 10 times higher risk of having a particular type of chemotherapy kill their heart muscle when they receive it than somebody that doesn't have that. So that helps us identify during therapy who's going to be the most at risk. So there's a variety of different toxicities that can develop. That's the second bucket, patients that didn't necessarily have pre-existing heart disease, but during cancer therapy, they developed it. The third bucket are patients that did not have pre-existing heart disease, did not have heart failure or other symptomatic heart disease during therapy, but now, many years later, as they're growing up, they're getting on with their lives, they're at much higher risk of developing heart failure or cardiac death or sudden death as a result of cancer and its therapies. So pediatric cardio-oncology deals with all three of those vertical silos of patients.